liver, here is the stomach and bladder. All these things will be visible at the end of first trimester. Then the fifth component is pelvis, again 2 minutes, fetal kidneys and bladder. Here it is, again the fetal kidneys. You can measure the kidney, and according to the literature, the size of the length of the kidney is approximately equal to the gestational age in weeks plus minus 5. Fetal bowel, small intestine and large intestine, we have to measure them. We can have hyperechoic bowel, which is one of the minor criteria for Down syndrome in scoring. We can have diaphragmatic hernia, esophageal hernia, duodenal atresia. Most of these are with polyhydramnias, Crohn belly syndrome, and we can use Doppler to see the vascularity. If there is especially suspicion of any pathology which is like renal agenesis, you will get the renal vessels. And we can have large kidneys like infantile polycystic kidney disease. We can use Doppler to assess either the vessels are there or not. So there will be no need of looking for kidneys if you have a Doppler and you find the renal vessels. Hydronephrosis and pyrexia is important to be assessed. We will measure it, as I told you, 5 is normal, 5 mm. Kidneys with mild or severe hydronephrosis. We have to spend next 2 minutes on limbs. And leg means all 4 limbs, the upper limbs and lower limbs. You will see the hand and joints. Like here you can see the knee joint, ankle joint, wrist joint, the feet, and again the long bones. You can have the long bones can be small, like in osteogenesis imperfecta. Missing middle phalanx of 5th finger, and here we have club foot and rocker bottom foot. We can have sandal gap. Here is the case of club foot. Similarly, we can look for unilateral bones. We can have unilateral rhizomedia, which is short humerus. This was one of the cases recorded. That was 12 minutes we spend on fetal ultrasound. Then we have 8 minutes we have to spend on 4 things. The main 4 things are placenta, cervix, amniotic fluid, and umbilical cord. Why I made this 3-2 and 3-2? Because they have given an option that you can assess placenta with cervix. So making it 3.1, and then the amniotic fluid would be 3.2. But here they have given 3 minutes, but here I have separated it from there, and it can be 3.2A and B, whatever we can say. But they have given for placenta and cervix, they have given 3 minutes. In placenta, we will see the maturity grading, position, adherence, the retroplacental area, and Doppler. Total time is 2 minutes. Maturity grading, position, adherence, retroplacental area, color, Doppler. So everything to be done very quickly. Cervix length and the canal is open or closed, amniotic fluid, maximum vertical pocket and amniotic fluid index, and how it appears within 1 minute. Umbilical cord, number of vessels or any pathology in 1 minute, and color Doppler study of uterine artery, the umbilical artery, umbilical vein, and middle cellular artery and ductus venosus within 3 minutes. This is recommended, but it sometimes can take more time. For placenta, again, we have to see where is placenta, as it is antrofundal. We can measure its thickest area and compare it with the age, as we know it has the same correlation as I told you about the kidneys. the thickness in millimeters is equal to gestational age in weeks plus minus 5. And here is the amniotic fluid. There are some placentas, for examples, lying anteriorly and anterofuntal. This is placenta which is lying posteriorly. So localization is important. And then comes the placental position as compared to the, when you compare it with the, for previa with the internal os, you can measure it, either it is within 5 centimeters or not. This is complete previa. So whenever it is complete previa, we have to assess either is the complete previa symmetrical or asymmetrical. We can have some problems like battle placenta. Any placental abnormality, presence of myometric contractions or fibroids can be ruled out. Then we will see the vasa previa, and we can have placenta previa, theta or perpreta. If you have this thing in mind, you will assess. Otherwise, most of these things are missed. And you can have retroplacental hematomas. This is cervix, how we measure outer to outer and inner to inner. 4.5 outer to outer and 3.5 inner to inner is the recommended size by Bemis. This is open cervix, so it will take 1 minute. Look at this nice urinary bladder and fetal head and cervix, you can measure it. Then we come to amniotic fluid. For amniotic fluid, the two things which are assessed are the maximum vertical pocket and amniotic fluid index. And personally, I don't believe, and we had a lot of discussion on AIUM forum. You can be member of that forum. Is www.aiumhumanities.org. So there was a long discussion, and most of the people who are senior people in AIUM, they agreed with this thing that we can have a better measurement if we measure it longitudinally and transversely and take it mean and then measure the amniotic fluid index. I call it mean vertical pocket or mean amniotic fluid index. Look at this, the total is about 200, so the average will be 10 centimeters, whereas if you take this one, this is 7.4 centimeters, so there is a difference of about 2.6 centimeters if you don't take the mean. Sometimes it looks that there is amniotic fluid, so Doppler is helpful. It can be a small pocket, but not of amniotic fluid having cord inside. We can have polyhydramnios with some condition in which it will be pushed, and this is again very thin placenta, less than 1.5. We can have fetal demise in some cases, and there is oligohydramnios, everything is pushed and no heart. We can use Doppler to see the cord. Either there are 3 vessels or 2 vessels, and we can try it around the head to see either it is cord around the neck or not. The umbilical artery is a vessel which helps us to diagnose any placental insufficiency or IUGR, and this is how we take its sort of appearance. Straight vessel and the coiled vessel, it's landing down. These are the umbilical arteries near to the urinary bladder, and it is how we measure the SD ratio. Nowadays it is recommended to go to PI of umbilical artery, and we have got new charts for it. The cord insertion, and look at this, there is one vessel, so one artery. If you find one artery, means there will be one artery, one vein, which is usually related with chromosomal abnormalities in more than 50% of the cases. We can find acid diastole, which usually indicates IUGR, this cord around the neck. We can have some inferior abdominal wall defects related to the cord. We will assess the middle cerebral artery as discussed by Dr. Tausif Kamar. that it is reversal of the normal umbilical artery will have reverse of this diastole. It is usually going up, whereas this is going down. In pathological cases, it will be reversal. Ductus venosus is usually easy to find if you depend on erasing. If you depend on color erasing, you will get mixing of color, and you can find this thing here near to the hepatic vein, at the junction of the hepatic vein with IVC. In next Bemis, in August session, one of our paper is being published on ductus venosus, and one of our paper is published in June in Romania in one of the national ultrasound journal on ductus venosus in hypertension patients. This is one of the cases done during that study, abnormal ductus venosus. We can also have conjoined twins, so we have to keep that point in mind. So we can have abnormalities like we can have a dead fetus with edema, or we can have some other problem which we have to rule out. So I had been to many countries, but I was not to many parts of Pakistan. This is Rahim Yarkhan, and it has its own taste, and we had fresh things from there. This is our Pakistan, and Dr. Jatoi was there, Jala Jatoi, and I enjoyed that day with them on river. Uterine artery is very important to be seen in pregnant ladies. Look at this, the RI is 0.89, and here the RI is 1. If the lady is pregnant and you are having increased resistive index, it means that can lead to some problems. Gender is number one choice in our countries rather than all developing countries. So people ask, whenever I have told somebody that the fetus is dead, their next question is that it was male or female. So gender is important. It is not included in 22 minutes. You can spend another minute on gender to see the male or female. You can use 3D, 4D to make the gender, and report writing is also not included in 22 minutes. This was sent by one of my students by SMS. You can read it. जो यकीन की राह पे चल पड़े, उन्हें मंजिलों ने पनाह दी, जिन्हें वसवसों ने डरा दिया, वो कदम कदम पर बहक गए। तो अगर आप नहीं डरेंगे तो शायद कुछ करते रहेंगे तो आप बेदा नजदीक का डेरा इसमें आगे दरमियान में करते रहेंगे। तो डरे ना, इंशाल्लाह अल्लाह ताला साथ देगा। Sometimes the fetus can have